Thank you, Dr. James Barone, for talking to us about the 80-hour work week in surgical training. I'm going to ask a few questions starting with your background as a program director.
I was a program director for about 24 years, and I started out in a small hospital in New Jersey for 5 years, and then I moved to Stamford, Connecticut, where I was also a chairman of surgery and residency program director for almost 14 years. And after that, I was at Lincoln Hospital in the Bronx, New York, and I was chief of surgery and was sort of the site director for some rotating residents that we had coming in from other places. So I've had kind of a long and varied career dealing with residents and medical students.
Can you tell a broad audience what happened to surgical training in the United States in 2003?
Well, in response to an incident that had happened many years before in the late 80s, the people who run surgical training in the as the residency review committee for surgery decided that it would be a good idea to do what was going on in Europe already, which was to start restricting the work hours. And in 2003, they mandated that residents could not work more than 80 hours per week. And there were some loose ways to sort of beat the system, but mostly that 80-hour week had to be observed. It could be averaged over 4 weeks, and there were some other slight loopholes for educational conferences, but by and large, everybody adhered to or attempted to adhere to the 80-hour week.
What were the hours like before that?
Well, before that, it was pretty much wide open. There were numerous ways to do it, but many people worked more than 100 hours a week, and I will honestly admit that I was one of those people. When I was in the early days of my program director career, we did not have any restrictions on hours, but I would say that most of the time I did not personally have the residents work much more than 80 or 90 hours a week, although depending on vacations and illnesses and things and covering, there would be times when they did work very, very hard and way past what is almost really a rational amount of time. But the impact of the 80-hour week, I think, is still debatable. It's a very difficult thing to research, and lots of people have tried. And it's hard to do research on this because there is no control group. There's no group that was left to do their 100-hour week, and so it's hard to compare. And they're all before and after things, and it's really tough to actually get a grip on whether this has helped or harmed the patients, or even helped or harmed the residents. And there have been many attempts to figure this out, because the trade-off for working fewer hours is that there are more handoffs and transitions that have to occur, and it is unclear whether patient safety is improved by having residents who aren't working so many hours, or is the handoff situation creating more patient safety issues than anticipated, because everyone just didn't really think about how that was going to go down after this all happened. And of course, as you know, and perhaps some of the folks watching this don't know, that this a couple of years ago was tightened up, and now first-year residents can't work more than 16 hours at a time. And now even more handoffs are taking place. And again, there'll be a flurry of research about whether this is good or bad. And as far as the residents are concerned, it's also debatable how this has helped them, because many residents are not using the extra time they now have, time off, for study or for learning. They are, I'm not sure what they're doing, because I've even seen papers where they're not even sleeping more. So what in the heck are they doing? I don't know. Maybe they're playing video games, because they're supposed to be able to be a better surgeon if you play video games. That's possible, I'm sure. But there have been unintended consequences. And if I might digress for a moment, because it's one of my pet peeves, the whole thing about the 80-hour work week is based on a very unfortunate case that took place in New York City, and I think it was mid 80s. A young woman came into an emergency room and was sick, and it wasn't clear what was going on. She was admitted to medical service, and she died in the middle of the night. And it turned out she had been taking some drugs and didn't tell the residents. And the residents had been up for almost 24 hours, or at least 18 hours when she first came in. And then there was a question of supervision. They talked to an attending on the phone, but he didn't come and see the patient. And anyway, this was all huge headlines in New York City because the woman was the daughter of a newspaper investigative reporter, and it made a lot of media pay attention to this, and it all sort of came to the Bell Commission, which was a group of people who were assigned to investigate all this, and they decided that the work week should be 80 hours. And the problem is that the event that took place, an 80-hour work week wouldn't have changed any of the circumstances of the inciting event because the residents involved hadn't been working an inordinate amount of time. In fact, except for first-year residents, even now in 2013 and 2014, you could still work 24 straight hours. So there were some issues about, again, the supervision, and that certainly could still happen. And so I'm not sure how the extrapolation to the 80-hour work week took place, although I do know that Bertrand Bell, who was chairman of the Bell Commission, did state in writing that the 80-hour number was plucked from thin air while people on the Bell Commission were sitting on his porch and they were just throwing numbers up in the air, and they decided, well, 80 hours sounds like a good number. Why don't we just do that? And as you may know, in Europe, the European Union is down to 48 hours per week, but it has just come recently to light that many, many residents in the European Union are working far more hours than 48 per week, because that system has a tremendous loophole in it, which is it's averaged over 6 months. So what hospitals are doing is working the residents way past 48 hours until a certain time, and then they realize, okay, now we got to give them a week off so that the average will come back down to 48 hours. And so residents are having fatigue issues and the same sorts of things that we see here, even though on paper they're working almost like 60% as much time as residents in the United States. So this is a tremendously difficult area to dissect and to really figure out what is going on. And most people that I know think that the hours are going to go the way of the European Union, which is they're going to be ratcheted down. It's going to go down to 65 hours or 60 hours and then down to 48 hours.
Regardless of how the present 80-hour maximum has failed to make the difference it intended to make.
Exactly. Without data, without any evidence. In the era of evidence-based medicine, this is going to take place just because it sounds like, just like the random pick of 80 hours, it sounds like if 80 hours is good, then 65 hours or 48 hours must be better, so let's just do that. And by the way, the other thing that's happened that I think is interesting is that some papers have shown that when the residents are on duty, they're working much, much harder because there are fewer of them on duty at a time. And therefore, they have no breaks. They work like, continuously doing paperwork and electronic charting and seeing the patients about 12% of the time, it sounds like. And then the most of the time is with paperwork and everything. And the educational experience is also negatively affected because night float, which is a very popular night float for those who don't understand, is the residents basically work a night shift. They may come in at 8 p.m. and work till 8 a.m. or some variation of that. And obviously there are no educational conferences going on from 8 p.m. to 8 a.m. So those residents during that night float time get essentially no didactic teaching whatsoever. And, it's difficult to, again, understand how is this working? Does it really, is it better? Because most of the residents that I hear from, because I still keep in contact with some people who do this still for a living, and that is that they don't like night float. They hate it And the way it's being done is at a week at a time or maybe 2 weeks at a time. And that's not enough time to adjust to a night shift, because sleep deprivation research shows that you got to work at least 3 or 4 weeks of a night shift before you get completely adjusted. So just doing a week of night float is not going to solve the fatigue problem at all. And it's unclear that it's useful for any purpose: educational, patient care, patient safety, or any of those other things that everyone worries about. And that was the, that was the reason the 80-hour work week was established, in the name of, quote, patient safety. It's going to be better for the patients if we don't have tired residents. But I'll tell you an interesting fact. When I worked as a resident, approximately half of my residency was every other night. I can't even tell you how many hours a week that is, but it's a lot. It's way more than 80. But when we were on call, we slept most of the time because we knew all the patients. We weren't cross-covering anything, because there was always somebody from every service on, because we were working every other night. And, I'm not sure that was really worse, And I think if you talk to residents, they will tell you it's too intense when they're working. There's not enough support or people around, and they don't like the trying to cram all the hours into or all that they have to do into the allotted time. That's difficult for the residents to manage. So it's unclear to me whether this whole thing is working or not. I know we will never return, though, to the days of 100-hour work week. It's not going to happen.
And who are the authorities that are that will be responsible if the mandate comes to an even lower number of hours for a work limit? And who pushes back? Who are the bodies pushing back against that?
Well, here's the thing that I think, I have to be honest and fair to say that when the 80-hour work week came to be in the early 2000s, there was intense pressure from Congress and politicians to do something. And I think that the RRC and the boards were put into a very difficult position, which was, if they did not do something to control the hours, then there was going to be legislation. And I think we all know that we would prefer to have our own people do something with it rather than have the government take over medical education. And so I think they were forced to do this. Now the question is going to be, what will happen in the future? I think the same influences are at play, and that is, we don't want government legislation to make these decisions. We would rather have medical people do it. And I think that it puts them in a very tough spot. So I think it's very easy for someone like me, who didn't have to make the decisions, to be critical. But they were in a tough spot, and they still are. I think, there's pressure to limit the work hours even more. And, I think to stave off the government being the one to do it, there are going to be more things happen on this front. And I just, I think it's got to be acceptable to political forces. And the patient advocacy groups are extremely strong and vocal. And I don't blame them. Many of them are patient advocacy people because they've had issues where family members or friends have died because of patient safety issues. But I think the problem is, if you do something and you don't know what the effect of it's going to be, just because it sounds like a good idea, that is not the way to solve any of these kinds of problems. I mean, it would be like saying, let's take out this organ because it sounds like a good idea. There's no evidence to do it.
Well, can't this dialogue take place somewhere where say program directors and academics say, we really do need to work this many hours. It's actually, we believe it's safer for patients. We believe we'll train safer doctors. We believe.
Yeah, I understand what you're saying, but I have to tell you that when I was a program director, I was fairly active in the Association of Program Directors in Surgery. And everything you've said was many times repeated in open meetings, in meetings of the Program Directors Association. And, I think that the people running the show really felt that they couldn't abide by what the program directors wanted, and were really more interested in again avoiding government interference. One other very bad side effect of all this, by the way, is that if you talk to residents, they've been I don't want to say coerced, that's probably not the right word, but I think they feel pressure to lie about the amount of time that they're
Absolutely.
working. And I think that it's I don't think it's a good trait to instill in a young doctor that it's okay if you lie,
Right.
because if you're going to lie about this, then, well, if lying's okay, well, I'll just lie about some other things. And I think it's easy to fall into that trap. And I hate to say this because it's not something that is we should be proud of, but it is a fact. And I think you and everyone else who has anything to do with residents know very well that they will fudge their numbers.
Yeah.
They will cut corners, and they will stick around if they have a sick patient because they feel that it's their duty to do so. However, then they have to make up their hours. They have to write things down on there, however you're tracking it. And I'll tell you a funny story. When I was working in New York, the state, because the Bell Commission actually started in the state of New York, so the system there was fully honed by the time I got there in early 2004. And the funny thing about it was that the state would come and investigate, and they would talk to the residents, similar to the RRC. They would take the residents into a room one-on-one and say, what kind of hours you're working? And the residents would, of course, lie. And then they would look at charts, and with electronic records, they could find progress notes where a resident wrote something or a case ended and a resident was involved past the time he said he was there. Right. And they would fine you when they discovered that. And so it depends on how it all works. But it is possible for, if the state or whoever's doing the investigating is diligent, you can unmask these, subterfuges of, and it again, it's not good because the place gets fined, and the residents again are, it's clear they're lying, and it's not a good thing to do. Yeah. So these are tremendously difficult issues, and I don't have solutions. I don't know, but I don't think that the 80-hour work week is the end of it by a long shot. But it's nice to know, though, that it doesn't work in Europe, because for years that propaganda has been, touted. Well, it works in Europe. Why can't we do it here? Well, you know what? It looks like it doesn't work in Europe. At least it doesn't work the way it is allegedly written. It's being violated all over the place. And but it is going to be more. I think there will be more controls. More. It's going to go. The number of hours is going to go down. It's not going to just be 16 hours for first-year residents. Right. It's going to be expanded, especially if more incidents occur, like residents in traffic accidents after a shift. There's a case in Ireland or Scotland, actually. I'm sorry, that occurred a few months ago. A resident had worked a 12-hour shift and was in a traffic accident on the way home and was killed, unfortunately, a woman. And, there was a hue and cry about fatigue doctors and all that. But 12-hour shift, I mean, how much shorter a shift can you do? How are you going to cover the hospital if you can't even work 12 hours? And I guess this poor woman had worked several night shifts. And again, it was, I think, a function of not acclimated to nights. Possibly the fatigue, even for a 12-hour shift, was too much. It's a sad case, but those kinds of things get a lot of publicity when they happen. Sure. And I don't demean it at all. I mean, it's very sad that this poor woman lost her life. But it has a big impact on the way people see this. And again, the fatigue and sleep thing overwhelms the patient safety and the handoff transition issue a lot. And so that's why I think it's going to continue to, the amount of work hours is going to be decreased in the States. And it's just a matter of time, I think, before we see it.
Okay. Thanks. Thanks a lot for your perspective, Dr. Barone.
Thank you for asking.
We'll talk again soon.
Sure. Bye-bye.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.